Hello, everyone. Can you guys hear me? Hi. Hello, Sanjosa, Linda. Hi, guys. Okay, great. We have a smaller group today. Obviously, we had to push our time back. We had the COCA call today. Hopefully, some of you were able to participate in that. Okay, so let's go ahead and get started. Let's try to get going on this. I know it's Friday. Everybody wants to go home. So I completely understand. All right. Well, we are going to be talking about environmental services today, which is a really important part of infection prevention. It's really one of those things that are like the bread and butter to preventing infections in a healthcare facility, is how well is your environmental services staff performing, their cleans, both their daily cleans, terminal cleans, etc. Okay, so we're going to get started with some questions, which questions are always good. Okay, so question number 1. The key to cleaning and disinfection of environmental surfaces is the A. Use of specific antiseptics for each surface. B. Physical removal of visible dirt, organic material, and debris. C. Assignment of trained staff to each department. Or D. Maintenance of equipment used for cleaning. Okay, just a few more seconds. All right, I think we have had everybody turn in their answers. Okay, so the overwhelming answer that everyone chose is B, but I also had people choosing A or C. So let's walk through this. Let's walk through this situation. Okay, so the key. The key to cleaning and disinfection of environmental surfaces is A, the use of specific antiseptics for each surface. Why is A not the correct answer? Who can tell me what the definition of an antiseptic is? What do we use them on? Okay, very good. All right, so disinfectant should be the word. That's what one of the comments is. Antiseptic is on skin, and then Fran said skin, right? So this is where they're gonna get you. So you have to know that your antiseptics are for humans, something that is living, an animate thing, not an inanimate thing, right? So we're not using antiseptics on our desks or on our doorknobs. We would be using disinfectants. Okay, so already we can get rid of A as one of our answer choices. Assignment of trained staff to each department, that seems a little bit misplaced. So yes, training staff is extremely important, but assignment of trained staff to each department, not entirely sure that that's the key to cleaning and disinfection. So C would not be one of my answer choices. Maintenance of equipment used for cleaning. Now, for me personally, I feel like when taking this, I would really narrow it down to either B or D. Maintenance of equipment used for cleaning is very important, and they talk about that in the APIC text. So in the APIC text, they talk about you ensuring that your equipment, the equipment that your staff are using, is checked. It's actually really important. I recently was doing just a quick look in one of our environmental services cart, and I found this broom that just looked like it needed some help. It was very, very, very frayed. It was a hot mess express. So I actually reached out to my director. I was like, hey, can we, take a look at some of the equipment and see can we make sure that it's in good working condition? So that is important, but it is not the key, right? It's not the key. What is the key is the physical removal of visible dirt, organic material, and debris. So you have to think about what is most important. They really love to ask you questions like this on the exam. What would you do first? What is most important? What is the key? They're testing you. They're saying, are you able to look at these answer choices and identify what is the absolutely most important thing? It's the same way that you would look at cleaning of instruments, cleaning of an endoscope, right? If I don't remove bioburden, organic material from an endoscope, or surgical equipment, can I actually get them sterilized and high level disinfected? No, right? Because if it's not clean, it's not sterile, right? So it's the same thing for our environment. Obviously, we're not sterilizing, bedside tables or anything like that. But the most important thing to cleaning and disinfection is the physical removal of visible debris, organic material, of visible dirt, organic material, and debris. Does that help? Don't let them trick you, all right? And you always have to you have to think. You have to think how they want you to think. That's half of the work, is figuring out the different tricks that they use on the test. All right, physical removal of visible dirt, organic material, and debris. Rationale. Accumulation of dust, soil, and microbial contaminants on environmental surfaces in healthcare facilities is not only aesthetically displeasing, but evidence indicates that it also plays a major role in the spread of healthcare-associated infections. Studies have shown that many microorganisms survive on surfaces for long periods. The key to cleaning and disinfecting environmental surfaces is the use of friction to physically remove visible dirt, organic material, and debris, thereby removing microorganisms. Perfect. All right, next question. A new environmental services employee has been asked to clean up a large blood spill on the floor in the OR. How should he proceed? A. He should mix an EPA-registered disinfectant with water in a bucket and mop up the spill. B. He should place absorbent material over the spill and pour the correct dilution of disinfectant over the material for the recommended contact time. C. He should pour undiluted bleach directly on the blood spill, wait 10 minutes, and then mop up the spill. Or D. He should place absorbent material over the spill, dispose of the material after absorption, and then mop the floor with an EPA-registered disinfectant. So I'll give you a little bit more time because it's a longer question. Okay, sorry, wanted to make sure I gave you guys time. All right. Okay, the good thing that I'm seeing is that the group has narrowed it down to two choices. Everybody is either choosing D or B. So that means you have crossed out A and C. He should mix an EPA registered disinfectant with water in a bucket and mop up the spill. We know that that should not be done. And then he should pour undiluted bleach directly on the blood spill, wait 10 minutes, and then mop up the spill. And okay, that's incorrect. So we were able to select those two. Now, from these two answer choices, let's go ahead and read them again. So B, he should place absorbent material over the spill and pour the correct dilution of disinfectant over the material for the recommended contact time. D, he should place absorbent material over the spill, dispose of the material after absorption, and then mop the floor with an EPA-registered disinfectant. Okay, So with one of these, we are missing a really critical step. With one of these answer choices, we are essentially putting the employee in a more of an unsafe situation because we are not deactivating organic material, right? So which of these two, of B and C, would provide the EVS employee with a safer cleanup? Would B do that, or would D do that? Okay. All right, so the correct answer is B. He should place absorbent material over the spill and pour the correct dilution of disinfectant over the material for the recommended contact time. What is the rationale? Cleaning of a large blood spill may be a risk for acquisition of bloodborne pathogens. So immediate inactivation of any pathogens before cleaning is important to reduce this risk. Absorbent material may be placed over the spill to contain it, and then the correct dilution of an EPA-registered disinfectant can be poured on the absorbent material to reduce the bioburden. After this, the absorbent materials can be gathered up and disposed of, and the area can be cleaned. Does that make sense? That help explain it a little bit better? Do we see why between B and D, B was the correct answer? Okay. Okay, good. I know. Because you would, if you read through the answer choices too quickly, you can get confused, or it can be a little bit overwhelming. You can be a bit unsure. So remember, I always recommend narrow it down and then work your way from there. Okay, these are what I call a black and white question. This either you know it or you don't. If you don't, make your best educated guess and keep it moving. Do not waste your time on the test with black and white questions because either you know it or you don't. So question 3, diluted bleach solutions stored in an open container must be changed every A, 30 days, B, 28 days, C, 24 hours, or D, 12 hours. All right, so like I told you, this isn't black or white. This is a black or white question. Either you know the answer or you don't. So many of you knew the answer right away. You were putting in 24 hours. Perfect. When you're taking the test and you get questions like this, it may be this, or it may be something along the lines of, which of the following temperatures does Legionella grow best in? Or at what temperature is Legionella, killed, etc. It's going to be like very straightforward, and either you're going to know it or you're not. If you are unsure, do your best guess and keep it moving. Don't even flag it. Do not flag it to go back to it because that knowledge isn't going to just magically appear. So just good test taking is knowing what you know and knowing what you don't know so that you don't waste your time. All right, 24 hours. If a diluted bleach solution is stored in an open container, the chlorine rapidly dissipates and therefore must be prepared daily. When stored in a spray or wash bottle or in a closed, brown, opaque container, the bleach solution remains stable for 30 days and will retain 50% of its initial value. Okay, very good. Question 4. Green cleaning is a new approach to environmental cleaning that aims at reducing harm to human health and the environment while maintaining or improving the hygiene of the healthcare environment. Which of the following green strategies would be appropriate to implement? 1. Replacing floor strippers and finishes that contain heavy metals and asthmagens. 2. Substituting disinfectant room cleaners with less toxic detergents. 3. Employing carcinogen-free carpet cleaners. Or 4. Introducing high filtration vacuum cleaners. And you have several options down here. One, I'm not going to go through all of them, but go ahead and see which answer you think is correct. Okay, alrighty. So for this one, we have a lot of different answers. Um, lots of different answers, and only a couple people chose the correct one. Only about 3 people. Okay, so let's walk through it. As an infection preventionist, whenever you're thinking about implementing some new type of strategy, when a issue is brought up to your department, and you obviously want to work with them, we want to be environmentally conscious, completely understand. But there is one specific answer choice in here that you would be very hesitant to adopt. There should really be only um, one number here that should make you be like, I don't think that that's the best thing for infection prevention purposes. And that answer choice is going to be 2. So substituting disinfected room cleaners with less toxic detergents, um, that is concerning because we know that there is a difference. In Georgia, she brought this up. She said, "See, only because a detergent is not equal to a disinfectant." Exactly. So we know that we have some neutral cleaners, some neutral detergents, and that means that we could potentially have longer contact times. You could go from using a current disinfectant that gives you a contact time of about 2 minutes, 3 minutes, to a detergent or a neutral cleaner where it's extending that contact time for up towards 10 minutes. And so that is going to be a really a big concern for an infection prevention department, because yes, we want to work with teams, and we would be more than willing to implement 1, 3, and 4, but when it comes to 2, that should be the one that really kind of calls to your attention. Okay? So what's the rationale? The effective use of a disinfectant is part of a multi-barrier strategy to prevent healthcare-associated infections. CDC guidelines recommend that non-critical medical equipment surfaces should be disinfected with an EPA-registered low or intermediate level disinfectant. Current certification programs for green cleaning products and equipment do not cover EPA-registered disinfectants. Okay, so I hope that brought some clarity for that question. Okay, true or false? True or false? If a diluted bleach solution is stored in an open container, the chlorine rapidly dissipates and therefore must be prepared daily. Is that true or is that false? If a diluted bleach solution is stored in an open container, the chlorine rapidly dissipates and therefore must be prepared daily. All right, very good. When stored in a spray or wash bottle or in a closed brown opaque container, the bleach solution will remain stable for 60 days and will retain 50% of its initial value. Is that true or is that false? It's false. Very good for those of you who said it's 30 days. I know we just covered it, but guess what? If I'm going over it twice, within just a couple slides, that means it's important and you will probably get a question about it. All right, so let's dive into our environmental cleaning. All right, so I just touched the bed rail. This is a wonderful slide that I borrowed from a colleague, Miss Linda Green. She did a really great presentation for an infection prevention boot camp that I attended a couple of years ago. So 100 to 1,000 bacteria are transferred by pulling patients up in bed, taking a blood pressure or pulse, touching a patient's hand, rolling patients over in bed, touching patients' gowns or bed sheets, and touching equipment like bedside rails, overbed tables, and IV pumps. So, what does this tell us? This tells us that we have microbial pathogens and microorganisms all over the place, and it's very easy to contaminate your hands, which points out why it's extremely important to ensure that cleaning and disinfection is taking place regularly in your healthcare facilities. And depending on your your closeness, your relationship with the environmental services department, you might know exactly what their policies are like, or it might be something where it's a little bit more separated. You trust that they're able to do what they get done, and then you're only intervening whenever, you know, a leader is reaching out to you. Hey, I noticed this. Hey, I noticed that, etc. My recommendation is that you try to be as involved as possible. One of my biggest goals for 2021 for my facility is going to be more involved with our environmental services department. And I actually, so this was something that I wanted to do when I initially became an IP, but you know, my first year I was training. Basically this whole year we've been in a pandemic. It's been a pandemic, so it's been crazy. But I actually attended our environmental services training. So the first couple of days that our EVS staff go to do their classroom training and their computer-based learning, I did that, and all of my colleagues here have done it. And then right now, we're waiting to do our hands-on training for actually cleaning rooms until things slow down a bit, because I don't know if you guys watch the news, I don't know if you're seeing the numbers, but it is bananas. It's like, I just, I have no words. All right, so survival time of pathogens. So here we have some examples of pathogens and how long they can live, and this is important. One of the things that I find really interesting is that a lot of the times when you're having discussions with your nursing team members, they may not be aware of how long these pathogens can live in the environment. And it can be really fun. We actually have a little, so I bought this little wheel on Amazon. It's like, you know, the little wheel, and you turn it and then it'll stop, like a little Wheel of Fortune thing. And it has questions on there. And so one of the questions that I have on there is, how long can C. diff live in the environment? And it's really interesting because a lot of people will say, oh, you know, like a long time, 72 hours, 48 hours, like 2 weeks. And then when they hear 5 months or greater, they're just like, they don't believe it. They're like, what is this? This is blasphemy. And I'm like, no, it's true. So Staph aureus, including MRSA, can live from 7 days to greater than 12 months, C. diff for about 5 months or greater, and then norovirus for 8 hours to 2 weeks. So what this really highlights is that we need to ensure that we're keeping our environments clean, and that we're monitoring how these cleanings are happening, and that we have a good relationship with our EVS employees to understand what their process is and how they go about cleaning. Now, these are some examples, but you also have other pathogens that are really well known in healthcare, other gram-negatives, such as Acinetobacter and Pseudomonas. So Acinetobacter can be isolated in the environment for about 11 months, even greater. Pseudomonas aeruginosa, 16 months. Klebsiella, more than 30 months. So these are pathogens that we know, that we recognize, we see in our infection prevention work lists, and it highlights that they can live in the environment for a really long time. Listen, they've been around the block. They know the name of the game. They're here to stay, and so we have to learn to work with them and destroy them. That's what we have to do. All right, so cleaning, sanitizing, and disinfection. These are important definitions for you to know. Okay, these are very important definitions for you to know, because when they ask you questions, it might be easy for you to confuse them. So study cards, flashcards, flashcards, flashcards. You got to do some flashcards. So cleaning is the removal of foreign material, soil, dust, organic material from objects, and it is normally accomplished using water with detergents or enzymatic products. That is cleaning. Okay. Next up, sanitizing. It's the reduction in microbial population on an inanimate object to a safe or relatively safe level. Next, we have disinfection. This is the elimination of many or all pathogenic organisms, with the exception of bacterial spores. Surfaces must be cleaned before they can be properly disinfected. So again, this concept keeps coming up because it's really important. You have to do the cleaning before you can do the disinfecting or the sterilizing, all right? Cleaning is extremely important. And then you have cleaning disinfection. This is a one-step process unless the surface is heavily contaminated. Okay, so cleaning disinfection. One-step process unless the surface is heavily contaminated. So when we're doing the cleaning and disinfection, we're removing that foreign material, and we're also killing pathogenic organisms in one step. Now, let's talk about detergents and disinfectants. We briefly mentioned detergents and disinfectants for that question a little bit earlier on. So what are the differences? So detergents are more environmentally friendly and produce less offensive odors. They cost less than disinfectants, but do not effectively remove microorganisms from surfaces. All right, disinfectants are divided into low, intermediate, and high levels, and they have different kill capabilities based on the levels. So in general, our low and intermediate level disinfectants are used for cleaning surfaces and are reviewed and registered with the EPA, whereas high level disinfectants, sterilants for medical equipment, and antiseptics are evaluated and approved by the FDA. I know I mention this every time this comes up, and I'm just telling you because I do not want you to mess it up when you're taking your exam, and it's important to know. You have to know what EPA is responsible for and what the FDA is responsible for. All right? Do not let them trick you when you're taking the test. You have to know that. All right, so disinfectants. Once again, we're breaking it down, our low level, intermediate level, and high level. So low level kills most vegetative bacteria, some fungi, and some viruses. Intermediate level kills vegetative bacteria, mycobacteria, most fungi, most viruses, and some spores. And then high level kills spores as well as other forms of microorganisms. So those are going to be your high level disinfectants. And which federal partner is responsible for high level disinfectants? Is that the FDA? Is it the EPA? Okay, very good. Very good for those of you who are saying FDA. Good job. Okay, organic materials. Organic materials and disinfectants. Organic materials such as blood and protein inactivate many disinfectants. Organic matter must be removed from surfaces before applying the disinfectant. Okay, so one of the things that I've recently noticed in our COVID rooms, specifically in ICU, is that we have a lot of bioburden around the bed rails and the head of the bed, obviously because we're proning these patients. And so when you're talking about cleaning and when you're talking about disinfecting, I can't really disinfect that area until I make sure organic materials are removed. I need to make sure that I'm going in there, that I'm trying to get off as much as I can, with my PDI wipe and making sure that I'm getting rid of, any spills that could have happened to ensure that I'm actually disinfecting that surface in that area. When you have pronaceous material that's caked on different environments, it makes it, it's just, you're not really disinfecting unless you're getting rid of that organic material. This applies to every single portion of cleaning, whether it's the environment or whether we're talking about endoscopes or surgical instruments. You have to get rid of the organic material. You have to get rid of it. And it's best if it's done at point of use, right? So if, let's say, there's a bit of a blood splatter, it would be much easier if that blood is cleaned up right away, rather than 2 or 3 days later. Because by that time, it's really dried onto that surface. It's the same thing. Think about surgical instruments. If it's taking a long time for those to get to the back, to SPD, that stuff is caking and drying on there, and it's not good. So organic matter must be removed from surfaces before applying the disinfectant. CDC recommendation. The CDC recommends using disinfectants for cleaning horizontal surfaces, especially high-touch surfaces in patient areas, on medical equipment, in isolation rooms, and during outbreaks. So once again, this is one of our CDC recommendations, and it really highlights why the answer choice for switching to a detergent would have been inappropriate. Our recommendation is to use disinfectants. All right, manufacturer's instructions. Detergents and disinfectants must be used according to manufacturer's instructions. The dilution, the compatibility, the contact time, the storage, the shelf life. Detergents and disinfectants that are dispensed in pre-measured amounts may be preferred over those that require mixing. Pre-mixed solutions should not be further diluted or altered in any way. Machines that dispense pre-measured amounts of chemicals are more accurate and reliable than manual mixing of solutions. So some of the things you want to keep in mind. Yes, your machines, your machines that do a pre-measured amount and they mix things, you still want to ensure that you're testing the efficacy of the cleaner. So they have different strips depending on what type of cleaner you're using that are able to ensure that it's being diluted properly and that you have a good dilution so that in case there's a malfunction with one of the machines, something's going on, you're able to keep an eye on that. Next thing, okay, premixed solutions should not be further diluted or altered in any way. I always have to tell this story because it's just one of those things. When I was working at the health department, I was doing an infection control assessment. I was doing an ICAR at an acute care hospital down south in South Florida. And I'll never forget, I was watching an environmental clean of a room. Things were going relatively well. We were almost at the end of, the room being cleaned. And I see the EVS worker literally pull out a bottle of Fabuloso from her cart. She had a bottle of Fabuloso in her cart that she was adding to her cleaner for her floor because she did not like the smell of the cleaner that they were using. She felt like it didn't have a good smell, that it didn't make the room smell clean. And so she was adding an extra solution to the cleaner that they were already using at that facility. So keep in mind, if you're not actively engaged and talking to your EVS staff and observing, these could be things that are happening in your facility. And yeah, true story. All right, contact time, extremely important. Extremely important concept for your EVS employees, but for all employees that work in the hospital, really. All employees that are going to be coming into contact with your disinfectants, they need to ensure that they know the contact time. So the contact time is the time it takes for the disinfectant to kill certain germs. And the surface must remain wet. The surface must remain wet. This is very important. My colleague and I, Danielle Rankin, we would time, okay, when we were we were we were on it. We would time from the time that person started cleaning and that disinfectant went on there, how long it would take for that disinfectant to dry off the surface. And a lot of the times it was less than that 10-minute contact time that they were using for that Virex 2256, etc. So first thing, I know a lot of us in acute care are used to using disinfectants that have a shorter contact time than 10 minutes. But for a lot of our long-term care partners, that's one of the things that you need to keep an eye out for. And also, many of you who are infection preventionists have other responsibilities outside of the acute care hospital. You may have an ambulatory surgery center. You may have a dialysis facility. You may have a long-term care facility that you're responsible for supporting or assisting. Are they using the same products that you are using? And do the staff know what that contact time is? If you are an epidemiologist and you're going out to facilities, before you go on an ICAR, it would be good to have a call with that facility and get an idea of what products they're using to clean so that you can use that information for when you're doing your assessment. You already know, hey, I'm going to this long-term care facility. They use these 3 different types of cleaners or, et cetera, however many, and this is what I'm looking at. These Cavi wipes, they have a 3-minute contact time. The Virex 2256, they have a 10-minute contact time, so that when you're actually observing that practice, you already have in your mind what those contact times are. And that's just a tip, for things that you can do. All right, infection control and environmental services. The person responsible for the infection control programs should have a thorough knowledge of cleaning agents and disinfectants used by the EVS department. In addition to product names, the following should also be known: the active ingredient in the product, the directions for use, where and how it is used in the facility, and how to contact the manufacturer with questions. All very important things to know. All right, so now let's talk about the 2 zones of care. So you have the patient zone, and then you have the healthcare zone. So the patient zone is really where a lot of our high touch surfaces are going to be. This is going to consist of the patient's immediate surroundings. So many high touch surfaces are bed rails, their bedside tables. These are all places that can be contaminated and that are frequent reservoirs of microorganisms. And it's very easy for those microorganisms to go from those high touch surfaces to the patient. A lot of people don't think about that. You have to show them. You have to be like, okay, you just move that bedside table and you're getting ready to look at that port or access that port. Let's talk about it. Let's talk about it. Because we have so much stuff on this bedside table that we don't know when it was the last time that it was cleaned. And now we're getting ready to access a port. All right, let's talk about it. So you need to keep in mind when you're observing your cleans and when you're participating in your rounds, etc., how those areas are cleaned. What is cleaned first? What is cleaned last? There's some really interesting work that's being done at Johns Hopkins, and they're actually, they started to restructure. I learned this at the recent Shake. Well, it's not recent. How many years has it been? I don't know, 2. Shea conference, the last Shea conference that I went to, and they were talking about uh, basically how they restructure their EVS program so that now instead of starting in the patient zone, instead of starting in the healthcare zone, which is the peripheral area, to the high touch surfaces, they're starting with really introducing themselves to the patient, asking if they're able to move some stuff off of their surfaces so that they're able to better clean. And I'm really looking forward to learning more about that. I really haven't followed up, so I don't know if they've had anything recently published, but if you guys see anything, make sure to send it my way. I'd be more than happy to learn. But you need to be familiar. Just know that we have different zones within healthcare. All right, high touch and other surfaces. High touch surface items need to be cleaned frequently because of the high degree of handling and the risk of cross transmission of infection. Surfaces and items that do not need to be cleaned as frequently are those that are handled less often and are less likely to be sources of infection. Facilities should have written cleaning disinfection policies, which include cleaning and disinfection of high-touch surfaces in common areas. Now, another thing to keep in mind is if you contract an environmental cleaning agency, you need to be familiar with what their policies are, and you need to ensure that whatever policies they're using align with what the practices that you want at your healthcare facility. All right, so I literally talk about this course all the time because it is that good. If you want a fun course, please take the University of North Carolina Chapel Hill's Infection Prevention in Nursing Homes on Coursera. It is fantastic. They did such an amazing job with this course. One of the areas that they touch on is environmental cleaning, and they talk about, practices, surfaces, how long pathogens live for. It's just fantastic. Highly recommend it. And it's free. It's free 99. It's free 99. All that you have to do is give them your time, you know, let them borrow your brain so they can just fill it up with all kinds of good knowledge. And it's fantastic. All right, so environmental cleaning. Sterilization, disinfection, and cleaning. This is another this is another PowerPoint slide that I borrowed from Miss Linda Green from our infection prevention boot camp. And this is basically a picture of different surfaces that were swabbed that were growing microbial microorganisms. Microbial pathogens. So you can see it's all over the place. They're all over the room. They're everywhere. So you have to think about that when you are walking into a room and you're assessing a patient, you're doing your rounds. Think about what you're touching, what the healthcare provider is touching, and how often those surfaces are getting cleaned. Cleaning and disinfection policies affect the entire facility. It is important to assemble a multidisciplinary team, so nursing, administration, facilities, food services, to develop these policies. Facilities should have written cleaning disinfection policies, which include routine and terminal cleaning and disinfection of resident rooms. Patient rooms. Facilities should have written cleaning disinfection policies, which include routine and terminal cleaning and disinfections of rooms of residents on contact precautions. Now, when you have patients on contact precautions, if you're at a facility where you're using curtains, part of your terminal clean may include removing those curtains. You have to know, what are the policies? What am I looking at? And what are they supposed to be doing? What have they been taught? What have our EVS members been taught? What are the policies? And you have to make sure that the two things are communicating and that they're being followed, right? Because we can have SOPs for everything under the sun, but if the practice isn't being done, then they're just words on a piece of paper. All right, cleaning procedures. Cleaning schedules and procedures progress from the least soiled areas to the most soiled areas, like the patient zone, and from high surfaces to low ones. To ensure that all surfaces are reached, cleaning should be performed in a systematic manner. After selecting a starting point, such as the door or window, work typically progresses from that point in either a clockwise or counterclockwise direction. So why do we do this? Why do we always talk about a systematic manner? What's the importance of standardization? It's to really prevent, variance. We don't want everyone cleaning the rooms differently. We want to ensure that all of these important surfaces that need to be cleaned are cleaned, and that they're cleaned in a manner where we are not cross-contaminating, where we're not putting people at risk with the way that we're cleaning. So the general concept is, if I am going to observe my environmental services staff, I should be able to watch Susie, Patricia, Mark, and Ronald perform their daily cleans, and they should be very similar. They should, have a pretty systematic way of addressing it, so that way they ensure that they're cleaning all of the surfaces. It's not like when you're at your house and you can just kind of go all over the place, however you feel inspired, right? I feel inspired today, I'm going to clean the kitchen. I'm going to go from here to there and everywhere and bounce around. It doesn't work like that. These are healthcare facilities. We need to ensure that we have policies and procedures and that things are standardized to the best of our abilities. With attending, we're talking about environmental services. Like I told you, I attended the EVS training that our workers go to, and one of the things I noticed that they really didn't emphasize was the splash zone in our sinks and how we should be cleaning those sinks, and what the appropriate steps for cleaning those sinks are. And that's really something that I want to bring to the attention of, our team here, so that they're able to move that up and push it towards their corporate company, because they're responsible for training a lot of people. And if they're going down into that drain area and then coming back up into the surrounding sink space, that's, we could be cross-contaminating surfaces there. All right, so cleanest to dirtiest. Some of us are just better with visuals. So cleanest places are going to be our walls, our lights, and then we're getting into more of that patient zone, our bed controls, our bed rails, and then our bathrooms. Those should really be cleaned last. All right, high to low. Cleaning proceeds from high to low surfaces, allowing dust and debris from high surfaces to fall onto lower ones before lower surfaces are cleaned. this is this is so important. You wanna definitely make sure that when you're going when you're observing your cleans, that they are really cleaning from high to low, because the reason why we do that is so that all of those little dust particles can fall, and when you're, as they're falling down, you're able to clean them up because they're going to be, you know, lower on the ground. You're going to be able to mop them up, etc. Dusting. Dust contains fungal spores such as aspergillus. To capture dust without aerosolizing spores, dusting should be performed using a cloth or dust mop that is chemically treated or made of microfiber. Dusting should be performed first. Particles that fall to the floor will be captured when the floor is clean. Avoid dusting methods that disperse dust, like feather dusting, and dusters should never be shaken. This is another story. Can't make this stuff up. I promise you. You see some things when you go out there into the world of infection prevention. Okay, I was at a long-term care facility. I was watching a clean. Great job so far. Doing amazing. Then they get to the end of the clean, and I'm like, okay, all right, okay, we're doing good. I have some good feedback. Person's been doing great. They bring out the duster at the end of their clean, and they start dusting at the end of their clean. I'm just like, how does this make sense? Right? And then after they were done dusting, they put the duster with, the little feathery part, the little dusting part down here, the fluffy part. They put it on the ground and leaned the little stick part of the duster against a wall. And I was just like, wait a minute. What am I seeing? Because so far I've seen a really good clean, really good practices, but then this has just really thrown a wrench into the whole thing. So you have to pay attention. You have to see what people are doing, because that's a very easy conversation to have. You just talk, you talk to the employee, you explain to them why we shouldn't do that, and you can kind of see the lights go off. You see the lights go off. Some of our healthcare workers are coming from other industries. Many of them are coming from, hotels, other places where their practices may not be as detailed the way that they are in healthcare. So pay attention to these things. They're important. Cleaning equipment, mops. CDC recommends changing floor mopping solutions every 3 rooms and at least every 60 minutes. Used mops and cleaning cloths should never be returned to containers of cleaning solution, and they should be laundered or discarded after use. Handles and poles for mops, dusters, and other items should also be wiped with a disinfectant after use. A disinfectant must be used to clean floors in critical areas such as isolation rooms. This is one that a lot of people miss. A lot of people miss this one when it comes to, there's a lot going on here, but I'm specifically referring to this one. Handles and poles for mops, dusters, and other items should also be wiped with a disinfectant after use. An EVS worker's cart needs to be cleaned regularly. And so if you think about it, they're touching all of that equipment, right? While they're cleaning an isolation room, for example. And then when that equipment is coming out, we want to ensure that before it goes back on that cart, it is then it's cleaned before it gets put on that cart. Especially those places where that EVS worker would have been holding that equipment. And microfiber mops are gold standard. We love microfiber. All right, these are some examples of when EVS personnel should perform hand hygiene. It's a lot. There's a lot of hand hygiene. We all have to perform a lot of hand hygiene. That's why you got to make sure that you have good hand hygiene products in your facilities. All right, so before gloving and entering a patient's room to clean, right? After cleaning a patient's room and gloves were removed, before you're handling clean linens, after bagging soiled linen and placing it in a linen cart, after collecting and bagging trash and placing it in a trash cart, after handling soiled equipment, so mops, cloths, buckets after using the bathroom, before and after eating or going on break. Pay attention. Let's have this be an assignment for this upcoming week. If you guys have time, I know it's a little crazy right now, but go watch a clean. Doesn't have to be a terminal clean. It could be a daily clean. Terminal cleans take a bit longer, so I understand if you don't have time. Just make it a goal to observe a daily clean. Pay attention. They've handled trash. Do they continue to clean with those same gloves? Look at what practices are actually happening. I know that this is difficult. This may be an area where you haven't really had time to do a deep dive into in your facility, but it's important. It's important, especially for my EPIs right now. Those of you who are going out and doing assessment at our long-term care facilities and really trying to help our community partners prevent COVID, you have to pay, it's in the details. You have to pay attention to the details and the process. Education and training. Educational programs should be appropriate to the personnel. Appropriate personnel should receive job-specific training and competency validation on cleaning and disinfection procedures at time of employment. If EVS services are performed by contract personnel, the facility should verify that training is provided by contracting company. So this is what I'm saying. So I went to that contracted company's training, right? What is that training like? Have you attended it? Are there things that are missing from that training that you think are important and should be taught? Maybe you're not sure. Maybe you've never gone. I recommend you do it. Training and competency validation on cleaning and disinfection should be done annually. All right, so let's talk a little bit about education. EVS personnel often have the lowest education level among healthcare personnel. In 2007, the U.S. Census Bureau showed that 28% of janitors and building cleaners aged 25 years or over did not have a high school diploma, and 12.3% had 9 years or less of education. The lack of education can be compounded by an increasing number of individuals who are not proficient in English. The lack of formal education correlates with low levels of health literacy and understanding the rationale for cleaning policies and procedures, such as for isolation rooms. If the reasons for cleaning are not understood, thoroughness of cleaning suffers, and the environment becomes a source of cross-transmission of infections. Subsequent HAIs lead to undesirable patient outcomes and increased healthcare costs. Why do we talk about this? Because we need to find ways to communicate with our staff that they'll understand, right? You have to be able to understand the different populations that you have in your hospital. And that's one of the things that's really challenging and one of the things that I really love about the work that we do. We are talking to directors of entire programs and we're talking to our frontline EVS workers. And we would need to have different levels of communication and present information in a way that can be absorbed by our audience and that can be understood by our audience. What that paragraph is saying is if you don't find a way to help people understand the importance of their job and why it is really imperative that they follow appropriate procedures for cleaning and disinfection, they are not going to understand that they could potentially be putting people at risk by not performing those cleans appropriately. So here's our learning pyramid. 5% lecture, 10% reading, and gray is, this is all passive learning. 20% is audiovisual, all right? So what does this mean? About 20% of the things I'm saying, you're gonna remember. I hope it's the 20% that's gonna be on the test. 30% demonstration, you're having to demonstrate. Now we're getting into the active parts of learning. So you have 50% from discussion groups. You're having to think, you're discussing, you're exchanging ideas. It's really exciting. 75% practice by doing. Why do you think I tell you guys to go out and clean endoscopes, to go be an SPD, gown up, and clean trays and assemble them and push them into the sterilizers? Because that is 75%. That is active learning. Why is Luce going to EVS training and then getting that hands-on experience at the campus, hopefully soon? Because, you know, COVID's a little crazy, but it's my goal, quarter one, to do my hands-on training. But why? because that's active learning. I'm practice by doing. I'm gonna be doing that thing. I'm actively learning. And then 90%, teach others, immediate use of learning. So much of what we do, in infection prevention, teaching others, having discussions, presenting for team members. If I would just love to do education all day, every day. It would be a dream. All right, how are we doing on time? Okay, almost out of time, so let me just do this last one. All right, educational methods. It is important to use multiple educational methods such as visual aids, return demonstration, repetition, and hands-on training. When you work in smaller groups, you have larger opportunities for more interaction, better engagement, and then after an education session, individuals should demonstrate competency. How can you demonstrate competency? There's a written test. If literacy and or English proficiency are not a problem, providing a return demonstration. This is really our preferred. Method. This should really be our preferred method. And this is a big area. And I'm not just talking about our EVS employees. I'm even talking about our nursing staff, respiratory therapy, everybody. Providing return demonstrations. So this is the preferred method. And then testing thoroughness of cleaning, glow germ, ATP. All right, so this is actually a really fantastic YouTube video. Cannot recommend it enough. It's from the Oregon Patient Safety Commission, and it really goes over a training program for EVS employees, that special training, their supervised work, and then those mastery of their skills. And it just really does a great job of highlighting what a good EVS training program should look like, what that competency validation should look like. And I think it's a fantastic resource. So we'll go ahead and end it there since it's 5 o'clock. Does anybody have any questions before we go? Any questions before we go? We have some holidays coming up the next couple of Fridays. So, and I mean the next 2 Fridays. Next Friday is the 25th. The Friday after that is the 1st. So I might have to change the dates a little bit so that it's not interfering with the holidays, but okay, I'm behind. What does this say? Sorry. I'm behind in studying for my CIC. I can't. What should I focus on in the last 2 weeks? Okay, Debbie, this is what I'm going to tell you. The last 2 weeks of your test, you need to, so if you haven't done this already, I want you to do a practice exam that you haven't already done, or the one that you did the longest time ago. So if you've already done your 3, but the first one you did like 3 months ago, do that one. And then figure out what chapters, what areas you are still missing. What areas are still your weakness, because that's what you need to focus on. We like to be good at what we do, and so we have a tendency to just keep studying the things that we're good at because it makes us feel good about ourselves. That's not what you should do. You should focus on the chapters that you're missing and study that. So, oh, I'm doing really bad on cleaning, disinfection, and sterilization. Guess what? You need to go back, you need to read those chapters, watch some YouTube lectures, and keep it moving. Focus on your weaknesses these last 2 weeks before your test. And you got this. Good luck. All right. So I don't have any other questions on the line. So thank you guys. This has been a lovely 2020 with you all. I will send out, you know, I'll look to see what I can finesse for this remainder of the year, because I don't want cohort 4 to go on for a lifetime. But yes, we have lots of people saying Merry Christmas and Happy Holidays, and I have the same thing to you guys. Happy Holidays to all of you. Thank you for attending. Really appreciate it, and I love this group. So good luck to those of you who are taking your test soon. You guys are going to do amazing, and I'm really looking forward to getting more emails from everybody that's passing. Really appreciate it. Happy holidays. All right, bye guys.